Well, I rarely actually counsel the folks who are in hospice care. Most of my concern is with grieving families and bereaved families. So I tend to specialize in that area because they are the living. They are the ones who are left. And where your beliefs are comes into account. We respect all beliefs. The rainbow of beliefs that exist in this country are all respected. So we tend to make an effort to reach out, especially to those that don't have beliefs, that may feel themselves alone, just as your streetcar ad said. You know, if you don't believe in God, you are not alone. So we do have that come up, and occasionally there would be friction in groups between those who have a very strong faith and therefore may have an easier time with a strong faith.
Well, the hospitals, at least the ones I know about in New Orleans in general, have, and it may be a volunteer position, but there are religious counselors who come around to a patient's room and offer, to talk to them and give, spend some time with them. They do not have anyone available for the non-religious patients.
Okay, this is not true.
Well, let me just say one more thing, and then I want to hear what you have to say.
Okay.
So some years back, when I had personally experienced that, I wrote letters on behalf of our organization to all of the hospitals in the area, offering them the name and telephone number of a secular counselor whom they could call if they had, a patient so desiring it. We never got a call. Now tell me what's going on today.
Well, first of all, when a family is in a pre-bereavement situation, I don't really want to use the word emergency, but it is a crisis situation because there's so many emotions that come up, and people have difficulty working with those emotions because not everyone is thinking logically, and many people are in dire need of some kind of guidance. Just give me something to lean on. I'm having a hard time here. Now, at Cannon Hospice, we have a chaplain, and all hospices have a chaplain, but I really only work through Cannon, and our chaplain is non-denominational, and he's been through much training to learn how to be a chaplain. I mean, initially in life, this is his second career, initially he was a tailor. So he has a very broad view of human interests and does not proselytize in terms of what people's beliefs may or may not be. He's only interested in helping the family and helping the patients be comfortable and passing through this particular life phase into the death phase with as much comfort and ease as possible. So we're very privileged, specifically at Cannon. Most people who are not religiously oriented don't know where to go. And even though this program has been on the air, for 10 years now?
Yes, almost.
So especially in a town and in a state that is so religiously based, essentially. I mean, we, in New Orleans in particular, we celebrate death because we have the second line, and we have a culture of a celebration.
We may
death.
Celebrate it, but nobody's eager to go.
No one's eager to go, but I think that's probably a human quality as well. There is the will to survive.
Let me say that, and I get this from members of our organization as well as what I read elsewhere, very often the patient and his family do not have the same views on religion. And when you have a non-religious ill person, and the family wants to make decisions based on religion, at a time it's already a time of great emotional content. How do you all deal with that, or have you had to deal with that?
I personally have had to deal with that in my own family, but beyond that, it's important to recognize the stages of grief, which are kind of have a famous presence in our cognizant lives. And one of the first stages is often called denial. So there's a lot of denial going on, a lot of denial about what the reality is of the situation and what your reality has been throughout your lifetime. And then the second stage is often anger. So anger will be expressed. It's a natural emotion, and people are up against the wall. They're in a crisis situation. They're going to be mad. So we try to address all of those issues. Now, mostly with the Grief Resource Center, and I do want to give that phone number out again. It's 1-888-472-2585. We're in a situation where already the death has happened, the trauma has happened, and now we're in a bereavement situation, grief and loss. So we're not directly impacting the families who are still in the process of dying or in the process of going through a hospice setting. That really is the job of the hospice. The job of the Grief Resource Center is to extend psychoeducation and psychotherapy to those who have the need and don't have the resource. This is an extra resource where you can learn about grief and loss and address your issues with licensed or working on their licensed counselors.
I see. Well, we've been talking mostly about death and dying, but you counsel on other issues as well. What are some of the others that come up as important problems?
Well, I think that family separation, divorce and separation, has a tremendous impact not only on the specific individuals involved, but on the family situation, and in particular children. And we do specialize, not me personally, but some of the other people that are part of CARE and part of GRC, specialize in children and adolescents. So we do have play therapy facilities, and we also, the Grief Resource Center has a camp, grief, bereavement, and loss camp called Camp Swan, which is held on 2 different long weekends out of the year, basically 6 months apart, and the kids go out to Bayou Signet, and they have an overnight, and they have marshmallows, and they have activities to help kids process grief and loss.
What do you do there that's different from going to some other summer camp?
Well, I believe at summer camps, we don't talk a whole lot about if you've lost someone, you can't be in contact with your dad anymore, or your mom's moved out of state, these types of issues that are deeply traumatic for children.
You do that in a different setting.
Correct.
And so the summer camp is just to give them an opportunity to at least have some hours or some days of happiness and with their problems off of their minds. Is that what your summer camp does?
No. It's more relating again back to your placard on the streetcar.
Yes.
You are not alone. So to have the opportunity for adults and for children to meet with folks who are going through a very similar process of grief. They're going through the denial, they're going through the anger, they're going through the bargaining, and eventually most people have a similar goal of acceptance. I'm the one who has to get on with my life. And
okay.
How do I do that?
And so then similarly, when you have group sessions for young people, again, so they interact with each other and learn that other people have the same problems they do. Does that somehow or other relieve their anxiety and sadness to know that someone else is in a similar situation?